Welcome to the Retiree Open Enrollment for Plan Year 2021. Today we will be highlighting some important information regarding this year's annual open enrollment for state and county retirees. This presentation is a brief summary and does not constitute a legal document or contract and is subject to change. Our agenda includes the following: open enrollment, changes for 2021, making changes, Medicare, health and wellness, and tips on saving money. Open enrollment. This year, we are offering retirees a new way to attend open enrollment. The EUTF Virtual Fair gives retirees access to the same information normally available at our open enrollment informational sessions, but from the privacy and safety of their homes. Click for the latest information on health plan enrollment, health plan benefits, premium information, as well as upcoming changes for 2021. Retirees can participate in live webinars, watch informational videos from each of the health carriers with information tailored specifically towards EUTF retirees, and access important open enrollment forms and documents. Please also keep in mind that the new base monthly contribution, or BMC, will not be available until November or December, when the Medicare Part B premium amount for 2021 is published by CMS. To attend our virtual fair, simply log on to eutf.hawaii.gov/learning center, click on Retiree Open Enrollment Fair, and you will have access to everything you need to participate in this year's open enrollment at your fingertips. Technology needed to attend. Participants will need a computer and internet access to attend. For the best experience, use an up-to-date version of Google Chrome, preferred, Safari, or Firefox from a desktop or laptop. Important dates and deadlines. The election period is from October 15, 2020 to October 30th, 2020. During the election period, retirees can add, cancel, or change plans and add or remove dependents. Retirees who wish to make changes must submit an EC2 or EC2H enrollment form and any required supporting documents to the EUTF by October 30th, 2020. For retirees who do not want to make changes, no action is needed. Processing period. Enrollment forms received will be processed during the months of November and December. Once the enrollment is processed, a confirmation notice will be mailed to the retiree. If you are not enrolling or making changes during the election period, you will not receive a confirmation notice. The new plan year for retirees begins January 1st, 2021 and continues until the end of the year. All changes made during open enrollment will take effect January 1st, 2021. Health plan premium changes and changes to the base monthly contribution, or BMC, will also take effect January 1st. Please keep in mind that the new BMC won't be available until either November or December, when the 2021 Medicare Part B premiums are published by CMS. Retiree Health Benefit Plan reference guides were mailed out to all retiree homes and is also available on our website at eutf.hawaii.gov. In it, you will find information on dependent eligibility criteria, health plan options, Medicare Part B direct deposit agreement form, health plan premiums for next year, and EC2 and EC2H enrollment forms. HSTA VB Retiree Health Plans. For those under HSTA VB Retiree Health Plan options, eligibility is only available to those who are currently enrolled in HSTA VB Retiree Plans, the former VIBA members. Making changes. HSTA VB members must complete an EC2H enrollment form if making changes. Switching plans. HSTA VB members can switch to EUTF plans but cannot switch back to HSTA VB plans. No dual enrollment. HSTA VB members cannot enroll in both EUTF and HSTA VB plans simultaneously. Changes for 2021. HMSA plan changes. Effective January 1st, 2021, changed the in-network non-cutting surgery member coinsurance from 20% to 10%, not subject to the deductible for EUTF retirees. Kaiser Permanente plan changes effective January 1st, 2021. Applied a zero copay for the following preventive screenings and lab tests for members diagnosed with specific chronic conditions for EUTF and HSTA VB retirees. A1C testing and retinopathy screening for individuals diagnosed with diabetes. LDL or low density lipoprotein testing for individuals diagnosed with heart disease. INR, International Normalized Ratio testing for individuals diagnosed with liver disease and or bleeding disorders. Added Medicare covered acupuncture services for chronic lower back pain at a $20 copay per visit, up to 20 treatments annually. New Humana Medicare Advantage Plan, effective January 1st, 2021. EUTF Medicare retirees will have an additional medical plan option, the Humana Medicare Advantage PPO plan. This plan was designed specifically for EUTF retirees as a strict 90-10 benefit, meaning most in and out of network services are provided at a 10% member coinsurance and includes 100% coverage for certain preventive screenings. Some services are subject to the $100 annual deductible. There is also no coordination of benefits with original Medicare. More information available in the 2021 EUTF Retiree Health Benefits Highlights Guide. VSP plan changes, effective January 1st, 2021. Increase the retail frame allowance from $120 to $150 for EUTF and HSTA VB retirees, frame covered every other year. Increase the allowance from $120 to $130 for contact lens supply and added a $60 maximum member copay for contact lens fitting and evaluation for EUTF and HSTA VB retirees. Contact lenses covered every year in lieu of glasses. Premium rate changes effective January 1st, 2021. For information about the 2021 monthly premium rates that take effect January 1st, 2021, see the Monthly Health Plan Premium section in the 2021 EUTF Retiree Health Benefits Highlights Guide. Retirees who receive less than 100% employer contribution towards the base monthly contribution should use the Retiree Premium Worksheet located on the EUTF website to calculate your monthly premium cost. Making changes. EC2 and EC2H enrollment forms. For retirees who would like to make changes to their EUTF, please submit an EC2 or EC2H enrollment form during the election period of October 15, 2020 to October 30, 2020. Enrollment forms are available on our website at eutf.hawaii.gov. Retirees must attach required supporting documents such as birth certificates for newly added dependent children, marriage certificate for newly added spouse, or student verification for newly added dependent children ages 19 to 23. Mail forms to the EUTF. Deadline for submitting enrollment forms if you are making changes is October 30th, 2020. When completing the EC2 form, be sure to mark Open Enrollment and complete the retiree data section. Leave the Coverage Start Date section blank, and under Plan Selection, indicate your plan selection and any changes. On the reverse side of the form, lists spouse or partner and dependent children to be added, continued, or deleted. Lists Medicare information. Lists any other insurance. And finally, read, sign, and date the form. Be sure to mail forms to the EUTF. Our mailing address is at the bottom of the EZ2 form. Medicare. Mandatory Medicare Part B enrollment. The Hawaii Revised Statutes 87A-23, Section 4 requires that state and county retirees and their eligible dependents who are enrolled in EUTF retiree medical and/or prescription drug benefit plans must be enrolled in Medicare Part B when they become eligible. Notification deadline. Proof of Medicare Part B enrollment must be submitted to the EUTF within 60 days of becoming Medicare Part B eligible or enrolling into an EUTF retiree medical and/or prescription drug plan. Document submission. Please submit the following documents to the EUTF: Medicare card showing Medicare Part B enrollment, Medicare Part B reimbursement direct deposit agreement form, and Social Security Administration letter and/or invoice to your and/or your Medicare eligible dependents indicating the Medicare Part B premium amount. Failure to provide proof of Medicare Part B enrollment. Failure to provide proof of Medicare Part B enrollment will result in your and your dependents' disenrollment from the EUTF medical and prescription drug plans. General process of Medicare enrollment. Contacting Social Security. Medicare enrollment is handled by the Social Security Administration. Please contact Social Security about enrolling into Medicare, preferably 3 months prior to your 65th birthday. Call 1-800-772-1213 by phone, or you can enroll online at ssa.gov. EUTF Courtesy Reminder. EUTF will mail a courtesy reminder to EUTF retirees and their spouse or partner to enroll in Medicare Part B. Automatic Medicare Part B enrollment. If you receive Social Security benefits, Medicare Part B enrollment is automatic. However, you should call Medicare if you do not receive notification 3 months prior to your 65th birthday. If you are not collecting Social Security, you must take the initiative to complete the necessary forms to enroll in Medicare. Medicare enrollment periods. Medicare enrollment periods are used to determine when and how eligible individuals may enroll in Medicare. Please contact the Social Security Administration for more information on Medicare enrollment periods. Medicare Part B premium reimbursement. Reimbursement eligibility. Medicare Part B premium reimbursement is only available for retirees and their eligible spouse, partner, who pay Medicare Part B premiums. Reimbursement effective date. Quarterly reimbursement will be effective the latter of effective date of Medicare Part B coverage, retirement date, or first day of the month EUTF receives a copy of your Medicare card, Social Security Administration letter or billing invoice, and direct deposit agreement form. Individuals ineligible for reimbursement. There will be no reimbursement for beneficiaries who do not pay a Medicare Part B premium, for example, those enrolled in the Medicare Savings Program or Medicaid. Penalties and Part D premiums. EUTF does not reimburse penalties or Medicare Part D premiums. Social Security Administration letter. Submit a copy of the Social Security Administration letter or SSA letter or billing invoice indicating your Medicare Part B premium. Income-related monthly adjusted amount. If you are paying a higher income-related monthly adjusted amount or IRMA, please submit a copy of the Social Security letter or invoice to the EUTF annually. EUTF will retro reimburse up to 2 years from the date EUTF receives IRMA. Please check publications for updates. EUTF updates on Medicare Part B premium reimbursement requirements are communicated via the ERS Holomua newsletter and EUTF website. Please check publications for updates. Enrollment in non-EUTF Medicare plans. One Medicare plan only. Medicare requires that you are enrolled in only one Medicare Part D or Medicare Advantage plan. Disenrollment in EUTF Medicare plans. If in the future you enroll in a non-EUTF Medicare Advantage or Medicare Part D plan, you may be disenrolled from EUTF's Kaiser Senior Advantage Plan and SilverScript Medicare Part D prescription drug plan. For HSTA VB members, you will also be disenrolled from the medical, vision, and chiropractic plans which are bundled with the HSTA VB prescription drug plan. EUTF Medicare plan options. EUTF Medicare plan options include Medicare Part D prescription drug plan administered by SilverScript, part of CVS, EUTF Kaiser Permanente Senior Advantage Plan, the Humana Medicare Advantage Plan, and the non-Medicare HMSA 9010 PPO Supplemental Medical Plan. Health and wellness. Staying healthy and well are the best ways to help keep your health costs down and improve your overall quality of life. The EUTF encourages you to be well, be strong by taking advantage of the health and wellness programs available under your health plans. Getting your annual wellness exam can help identify risk factors and keep you healthy. Preventive and screening services can help with early detection of illness and disease. Tobacco cessation products and programs can provide guidance and support to help you quit smoking. No-cost blood glucose meters are available for CVS Caremark members. Disease management programs can help provide education and support for those with chronic conditions such as diabetes, heart disease, asthma, and COPD. And telephonic health coaching can help you get healthy and stay healthy with lifestyle changes, weight management, and stress reduction. We encourage you to take advantage of these health and wellness benefits to help you be well, be strong. Tips on saving money. Here are some tips on how you can save money and help keep costs down. Generic versus brand. Generic drugs can represent significant savings. Generic drugs have the same quality and performance as their brand name equivalent and can save you up to 80% in your out-of-pocket costs. Check with your doctor if a generic alternative is available for you. Mail order versus retail. Mail order can save you time and money if you are on maintenance medication. Mail order allows you to receive a 90-day supply for a 60-day supply copayment. For more information, call CVS at 1-855-801-8263 or Kaiser Permanente at 1-808-643-7979. Alternatives to ER visits. ER visits increase premium costs, creates congestion in the ER, and have higher copayments. Alternatives to the ER for non-emergent care include telephonic doctor visit, office visit with your primary care physician, chat or email with your doctor online, minute clinic, or urgent care visit. Explanation of benefits, or EOB. The EOB is not a bill. It simply explains how your benefits were applied to a particular service you received. Please review your EOB when received and contact your insurance company if you find any discrepancies. EOBs include the date you received the service, the amount billed, the amount the insurance paid, and any balance you're responsible for paying the provider. It also tells you how much has been credited towards any required deductible. This concludes EUTF's portion of the presentation, and we would like to say mahalo from the EUTF for your time and attention.